Laser cataract surgery is a very non-traumatic experience for patients. The patient would be on a stretcher and they would be asked to look into the laser, which is attached to which is part of a machine. They would look into a tube, and in the tube they would see a red light and some circles. They would then focus on the red light. The surgeon would then attach an interface between the laser and the person's cornea, which is a clear part of their eye. This is not painful at all and causes very little dysfunction. While the patient is looking at a fixation light, the surgeon would then choose on their computer the size of the incision that they would like to make, which would be used for the operation. The surgeon would then also choose the size of the hole in the front of the cataract that the laser would make, so that they would later have access to the contents of the cataract so that it could be removed. The surgeon would also then decide into what shape he or she would like the cataract cut and program that into the computer. This takes normally less than 30 seconds. Prior to starting the laser, you'd ensure that the patient was comfortable, and then just by simply pushing your foot on a pedal, the laser is switched on. It very quickly and totally painlessly cuts the small cuts into the cataract, which will allow the lens to be removed. It makes the capsulorhexis, which is a round circular cut, into the front of the cataract, which allows access to the cataract, and it makes 2 or these days maybe 3 small holes in the cornea through which the surgeon will later have access to the contents of the eye. All this is done with the patient just having some local anesthesia to the eye. They are totally unaware of any discomfort, and they might have a slight feeling of pressure on the eye. It is highly unlikely that any patient would be distressed by this part of the operation. Once the laser component of the operation is done, the patient would then be taken to the operating room. Depending on the surgeon, they might have some more anesthetic injected around the eye, or they might just have some more anesthetic drops placed onto the eye. The surgeon would then open the pre-cut wounds, which were made by the laser, and remove the front of the cataract, which itself had been cut by the laser. This is a very important step of the operation, as it allows access to the cataract. Using an ultrasound probe, the cataract or the opacified lens of the eye is then removed, and once there's no sign of any cataract remaining, a new lens is placed into the space where the cataract was. This lens unfolds in the eye and remains very stable in the little membrane where the cataract previously lay. The surgeon would then remove their instruments from the eye. The eye itself would have sustained very little trauma, in that there might be 1 or 2 incisions in the eye. The majority of surgeons would have an incision well below 3 millimeters of size, and the person should be able to see pretty well within a day or 2. The patient would then be taken out of the operating room to the recovery room, where they would be given their post-operative instructions.